Universal health care. Imagine living in a healthcare system and you find out that you have cancer. Of course, you want the best chance to survive, so you try a private drug not covered by your insurance provider. You feel that you have done nothing wrong as you just want to live and survive. But now that you found out because you've taken this private health drug not covered by your provider that they will no longer cover you and are simply going to allow you to die. For Linda O'Bull, she don't have to imagine the scenario as this is her story and how her universal healthcare system treated her. Today I'd like to share you with the information of research I found out about the many problems in the universal healthcare system. First, we'll look at how the quality of healthcare falls, how the waiting lines for treatment drastically rises. Finally, we'll discuss the financial and social cost of it. There's a new report from Europe that shows 1 in every 5 heart bypass operations are not receiving the best care while in the hospital, and some are actually dying that should have survived. One of the biggest, most disturbing problems from the study is that half the patients who died had not even been told that they're at the risk of even losing their lives, even though the doctors knew it was a big possibility. The final conclusion of the study is that two-thirds of the patients who died in these cases had from the healthcare provider poor organization, poor communication, and poor teamwork. Another example of the shortcomings of universal health care is providing medicine to the people that need it. For example, thousands of Alzheimer's patients were made to wait for over a year for a drug they desperately needed. They don't have to wait because of any problems with the medicine. The problem is with the universal health care system is they kept putting off the vote to include the medicine in their coverage. The vote was moved from 1 month to 5 months to a year, and then over 54,000 patients who need the drug, according to the doctors, could not have it because their health coverage would not allow it. Money to cover the healthcare system in Europe has also caused many deaths, as some kidney patients died while dialysis machines were not being used. The reason for this is because they don't have the resources to keep the machines running. Next, we'll look at how the waiting lines for treatments drastically rises in a universal healthcare system. For example, in Canada, to see a specialist or to get an elective surgery, people must wait about 8 weeks to see a doctor, more than triple the time here in the United States. The study performed by the Department of Health in Europe found that problems from surgeries were actually causing problems for the patients. These problems were not happening because of the surgeries, but from the wait time, people were having to wait to have their actual surgeries. This was happening because to see senior physicians, who are the ones that make decisions about surgery, were taking months to happen. The situation has gotten so bad in Canada, 121 patients who are waiting for bypass surgery were removed from the list because their condition had gotten so bad that they would not have even survived the surgery that they needed. A recent flu epidemic in Toronto actually made the waiting lines just to see a family doctor up to 5 to 6 weeks. Pat Boone of Newsmax tells the Canadian Supreme Court ruled in 2005 that their healthcare system was so bad that it violates Canadians' basic human rights. In a survey in Canada, 12% of doctors and 5% of the nurses believe that they have had patients die just due to healthcare waiting lines. Britain's Department of Health reported in 2006 that at any given time, 900,000 people are waiting for admission to the hospitals. Shortages also cause cancellations of 50,000 operations a year. In Sweden, the wait for surgery can be as long as 25 weeks, and the average hip replacement wait is more than a year, and by the large numbers, many will die waiting for this treatment. Now we'll discuss the economic and social costs of the universal healthcare system. Studies show that because of the long wait lines that we have discussed in the universal healthcare system, that citizens will buy their own private insurance because of long waits. When this happens, people are not saving money because they have to pay higher taxes because of the universal healthcare system and also for their health insurance. Also, a universal healthcare system would not be free, as the government would have to figure out a way to support and pay the bills for the healthcare system, which means the governments would have to find a way to raise the money, such as cutting educational funding or increasing our taxes even more. Especially with the United States being in such a debt right now, we do not have the money to support the universal healthcare system. Rules will be placed on the doctors whether or not they're able to perform expensive treatments on patients because of debt issues. If doctors are limiting to performing expensive treatments, then patients will not be getting the best cure and help that they can receive. Another issue that the universal health care brings up is the social question of it. Is it fair to not have people who exercise and live happy to have to pay for people who do not take care of themselves, who eat bad, smoke, drink, and don't exercise? Their insurance costs are generally much cheaper than people who drink, and is it fair to make them pay for the unhealthy? This is confirmed as my survey is 80% of the people when asked feel they should not to pay for the healthcare system who people who smoke. In conclusion, we discussed the many factors that makes the universal healthcare system a bad choice. Imagine if you were the patient of an 18-month-old child who suddenly stopped walking, developed swollen limbs, and screamed in pain. Even though the doctors see the systems, they are forced to tell you to wait for your turn for the bone scan and come back in 4 weeks. When they come back for the test a month later, they discovered the child has leukemia. This is the story of Paige Hansen of Saskatchewan, Canada. This and many stories like this are the reason we should never have a universal healthcare system.